I've developed a work tool for cosmetic doctors and nurses called Consentz. And essentially what this does is it replaces the patient notes that we'd normally keep in a manila file and then stuffed in a back in the filing cabinet. It's now all on the iPad. And you work through the workflow as a doctor or nurse would work through. So it's a very obvious and very linear process. Right, so you start with the appointment. So you click on your appointment. And then you give this to the patient while they're sitting in the waiting room. And they'll fill out their personal details. Then they'll do a medical questionnaire. So if they answer yes to anything, there'll be a box at the end which will ask them specifically for details. So, and you can either type it in or you can use the voice to text. So I'll try that now. Patient has high blood pressure, full stop. And that works very well. When the patient's finished the medical questionnaire, they'll hand the iPad back to the receptionist, and I'll generally be ready at that point to see them. So then I'll go through the medical questionnaire with them, and I'll start taking some treatment notes. And I think here's an opportunity when we could really start to educate the patient better about the kind of options and alternatives that are available on the market. So when it comes to treatment selection, you choose which treatment you're going to use. So we could use a Botox, and maybe we could use a filler. Then you've got the consent forms. So gone is the worry of no longer having a consent form with you. And you get the patient to sign it. And then the best bit for me was that you can take your before and after photographs. So you take a picture directly onto the iPad, it takes it straight into that patient's folder, and then you can use that picture to then put down your treatment notes. So if you're doing a Botox or a filler, you can draw directly onto the picture and put down the units that you've used. And then finally, you've got lot numbers. So if there's ever a product recall, you'll be able to find out exactly who you've treated with and get them back in to deal with them swiftly. But essentially, using Consentz in the clinic, I used to finish a back-to-back clinic at about 6 o'clock in the evening, maybe get out of here at 8 o'clock. I was so frustrated, and it was mainly doing the photographs. And now I finish my clinic at 6 o'clock and I'm maybe out of here by 6:10. It really, genuinely has saved me that much time.